Hey everybody, welcome back. Today we're going to be talking about sexually transmitted diseases. So you should have already gone over the reproductive system and its functions, and then also maturity and reproduction. So let's dive right in. Sexually transmitted diseases. What are they? Well, sexually transmitted diseases, or also known as STDs for short, are illnesses that can be spread from one person to another during sexual intercourse or activity. So that includes oral sex, that includes anal sex, and that includes especially vaginal sex. And basically, these are diseases that get transmitted whenever you're exchanging body fluids. So that includes blood or semen or saliva, even breast milk. And they're also known as sexually transmitted infections. So STIs and STDs are generally the same thing, just two different ways to name the same kind of disease because they're both transmitted through sexual contact. So let's talk about some examples of STDs. This first one is a really important one. It's AIDS, which is short for acquired immunodeficiency syndrome. And that disease, AIDS, is caused by HIV, which is the human immunodeficiency virus. These go together. HIV is the virus, which causes AIDS, which is the disease. And then you have your other types of STDs, such as genital herpes and genital warts, which we'll talk about later. And then also you have these common examples: chlamydia, gonorrhea, syphilis, which we'll talk about later as well, hepatitis B, and trichomoniasis, or mono. So let's talk about some symptoms and treatments of STDs in general. So one in specific, AIDS affects the immune system, and we'll talk about this later, so don't worry about this yet. But commonly, STDs cause rashes or itchiness and lumps, usually in the genital area. But almost all of them cause pain. So that might be a headache, that might be pain in the genitals, and it might be a stomach ache or fever. A lot of them have similar symptoms to that. And then as far as treatments go, HIV does not have a cure. A lot of STDs don't have cures just yet, but there are ways to treat them and manage the symptoms that they bring. But for the bacterial ones, they can be treated with antibiotics. And generally, if you have good hygiene, it can be easy to manage the symptoms and help treat STDs. So let's start with HIV/AIDS, which is a really important one. It affects a lot of people across the world. And the biggest cause of HIV or AIDS is sex. So this includes all the sexes that we were talking about before. But also another way to transmit HIV is by sharing needles for drugs or tattoos. So you know how needles you stick into your bloodstream, right? And if you were to take that out with the virus in it and inject it into somebody else, you could be transferring HIV. And that goes the same thing with this third point, which is contact with infected blood. So if you just touch it with your finger, that's not a problem. But if that infected blood gets into your bloodstream, then that's a big possibility of transmission. So some common symptoms of HIV when it develops into AIDS is having a fever, having rashes, having muscle aches. A lot of people that have HIV experience weight loss. And in general, what HIV does is it targets the immune system of the body. Do you remember what the immune system is? It's a system in your body that helps protect it from other illnesses. So like your common cold or maybe having a sore throat. All of those are things that your immune system deals with. So when you have HIV, it weakens that immune system. So sometimes colds or flus can kill somebody that has HIV. So it's very dangerous. And a way to see if somebody has HIV is you can do a blood test. And usually what they say is you test positive for HIV, or they call someone HIV positive, which means that they have this infection. So treatments, there are no cures for HIV as of yet. Scientists are still researching ways to cure it. But in general, medicine can keep HIV from becoming AIDS, which, remember, we talked about before, HIV is the virus and AIDS is the disease. So before the virus can develop into the disease, so that if it affects the person, we can try use medicine to keep them from getting the disease. And then we have genital herpes, which an easy way to remember this is herpes cause bumpies. And basically what herpes is it's a sexually transmitted disease, an STD, that causes cold sores, rashes, itchiness, and other sores in your genital area. So it is caused by the herpes simplex virus, or HSV, which can be transmitted through sex. And if you have oral sex with somebody that has genital herpes, you'll likely develop cold sores around your mouth. But if you have other types of sex, then you will end up with these symptoms in your genital areas. And it's very uncomfortable. It's not great to be itchy and have rashes down there, right? And this is another disease that we can test through blood. So you can test positive for genital herpes. As long as treatments go, again, this is another STD that does not have a cure. It is something that people are infected with for the rest of their lives. So it's very important that you be safe in regards to this. But there are medicines that can reduce outbreaks of rashes and itchiness and bumps. And it just helps with it. It doesn't cure it, it just helps with it. And lastly, we have syphilis, which is another STD, but this time this STD is bacterial. It's not caused by a virus, it's caused by a bacteria. And this bacteria is transmitted and spread through sex as well, which is why it's an STD. So some common symptoms of syphilis are just like the last one we talked about. We have sores and muscle aches, warts, and rashes. So this is another disease that causes skin issues, just like genital warts, and it also actually causes hair loss and fever. And this is another one that you can test positive for by a blood test. Lastly, there are treatments for it because it's a bacterial disease. You can treat it with antibiotics, and antibiotics are a way to fight bacteria. So this is usually the treatment for syphilis. And another way is to avoid unsafe sex in the future, which is an easy way to transmit this disease. So just like we were talking about, how do we prevent STDs? We just learned all about them, how awful they can be, what kinds of symptoms they can cause, and how a lot of them, there is no cure. The best way is to prevent them. So STDs and STIs are contagious and they're infectious. They can spread from any person to any person. So the most important thing we can do are these three things. One, you can get immunized or get a vaccine. And vaccines can help, but there's only currently 3 vaccines out for STDs. So that includes hepatitis and HPV. But for the other ones that don't have vaccines yet, it's important to be informed and inform others. So this means if you test positive for any sexually transmitted disease, it's very, very, very important that you let people around you know, especially possible sexual partners. You don't want to have sexual contact with them and give them or transmit this disease without them knowing. And just like that, it's important to be informed. If you choose to have sexual contact with somebody else, it's very important to know if they have tested positive for any of these STDs in the past. And lastly, it's important to avoid exchanging bodily fluids. Simply don't have sex. If you don't have sexual contact, it's very hard for you to get STDs. It's a very simple way to prevent them. Just like we're practicing safe sex, staying 6 feet apart because of coronavirus, it's very important to practice safe sex. So let's go over an example problem. Which of the diseases below is not transmitted through sexual intercourse? Is it A, syphilis, B, cholera, C, chlamydia, or D, gonorrhea? I'll give you a few seconds to think about it. You can always pause the video and go rewind to rewatch the beginning. Take your best guess. All right, well, if you answered B, you were correct. So as we talked about in this video, syphilis is an STD. So it is not going to be the answer because the question is asking for which of the diseases below is not transmitted through sexual intercourse, which means we're looking for something that's not an STD. So you can cross out A, it's not syphilis. It's either B, C, or D. Hey, wait a minute. Haven't we seen C and D before? Yeah, because they're sexually transmitted diseases. Chlamydia, gonorrhea, syphilis, genital herpes, hepatitis B, and trichomoniasis, genital warts, and HIV and AIDS. Those are all sexually transmitted diseases. But guess what I didn't mention? Cholera. Cholera is not a sexually transmitted disease. It's actually a disease spread by water sources that have been contaminated with feces. It's not transmitted sexually. So the answer is B. So in general, it's important for all of us to keep each other safe. So wash your hands, protect each other by staying apart, abstain from sex. Don't have sex. It's very easy to get sexually transmitted diseases if you do. Thank you for listening. If you have any questions, please reach out to us on WhatsApp or email us at info@caribed.org. Have a great day.